Welcome back to our series on liver disease. In the last video, we talked about liver inflammation, which is stage 1 of liver disease. Today, we're moving on to stage 2, fibrosis. Fibrosis is when scar tissue begins to form in the liver, and while it's more serious than inflammation, there are still steps you can take to manage and potentially slow its progression. What is fibrosis? Fibrosis occurs when repeated liver inflammation causes scarring. Think of your liver like a sponge. Normally, it's soft and flexible, allowing blood to flow easily through it. But as fibrosis progresses, scar tissue begins to replace healthy liver tissue. This scar tissue is stiff, and just like a damaged sponge, it can't function as well. What causes fibrosis? Fibrosis can develop from many of the same causes as inflammation, such as chronic hepatitis, B or C. Ongoing viral infection causes continuous liver damage. Non-alcoholic fatty liver disease, NAFLD, or NASH. Both lead to fat buildup and eventual scarring. Alcohol, long-term excessive drinking is a well-known cause of fibrosis. Other causes, some less common causes include autoimmune liver disease, certain medications, and metabolic disorders like Wilson's disease, or hemochromatosis. Stages of fibrosis. Fibrosis isn't just a single level of damage. Doctors sometimes grade it into 4 stages. Stage 1, minimal scarring that doesn't yet affect liver function. Stage 2, some spread of scar tissue, but liver function is still mostly preserved. Stage 3, significant scarring, leading to more noticeable liver dysfunction. Stage 4, extensive scarring, which may overlap with early cirrhosis. Some doctors even consider stage 4 fibrosis to be the beginning of cirrhosis. However, not all doctors use this exact staging system. Some simply classify fibrosis as part of cirrhosis, either compensated, when the liver can still function, or decompensated, when the liver starts to fail. How is fibrosis diagnosed? Fibrosis can be tricky to diagnose because, like inflammation, it may not show obvious symptoms in the early stages. Many people with fibrosis feel fine, but that doesn't mean their liver is healthy. Doctors can diagnose fibrosis using blood tests, imaging like elastography, which measures liver stiffness, and sometimes liver biopsies. If your doctor suspects fibrosis, they'll likely keep a close watch on your liver's health over time. Why is fibrosis a concern? The danger with fibrosis is that once scar tissue forms, it's much harder for the liver to regenerate. Over time, if fibrosis continues unchecked, it can lead to cirrhosis, where liver function becomes seriously impaired. At this point, managing the progression of liver disease becomes much more challenging. The earlier fibrosis is caught and treated, the better. Can fibrosis be reversed? The good news is that fibrosis can sometimes be halted or even reversed, especially in the earlier stages. Here are some key actions you can take. Address the cause. Whether it's a viral infection, alcohol use, or fatty liver disease, dealing with the root cause is the first step. This might involve antiviral medications, lifestyle changes, or avoiding alcohol entirely. Diet and exercise. Maintaining a healthy diet low in sodium, sugar, and unhealthy fats is crucial. Lean proteins, fresh fruits, vegetables, and whole grains can support liver health. Regular physical activity also helps manage weight and reduce liver fat. Medication management. Avoid any unnecessary medications that can harm the liver. Always consult your doctor about what is safe to take. Routine monitoring. Stay on top of your medical appointments and ask your doctor about testing for liver stiffness or fibrosis progression. This can help track any changes in your condition. In summary, stage 2 liver disease, or fibrosis, is when scar tissue starts to replace healthy liver cells. While it's more serious than inflammation, it's not too late to take action. By making the right lifestyle choices and addressing the underlying causes, you can slow or stop fibrosis before it progresses to cirrhosis. In our next video, we'll discuss stage 3, cirrhosis, and what that means for your liver health. Thank you for watching, and as always, Stay informed and proactive about your health.